Okay, now it's our honor to present. I'd like to invite Dr. Manar Ezzelarab Ramadan. Dr. Manar is an assistant professor of medical parasitology at the Institute, and she will present ethical issues in medical labs, perspectives, and challenges. Dr. Manar.
Dear colleagues and professors, thank you for being here today in 13th Annual Conference of National Hepatology and Tropical Medicine Research Institute. I know it was a very long day. I will take only just a few minutes. My topic is about ethical issues in medical laboratories, perspectives and challenges. Objectives: to define ethics. Objectives: to define ethics, to explain history of biomedical ethics, to highlight the importance of applying ethics in medical practice and pandemic research, to focus on 3 basic ethical principles related to medical laboratories: justice, beneficence, and respect. Why are ethics important? Innate human desire to see doctors as the most trusted and respected people in society. Trust is deviated from basic medical ethics. Ethics are the branch of philosophy dealing with values relating to human conduct. Ethics: what is good and what is bad, what is right and what is wrong. Moral principles based on value system. Ethical norms are not universal, but they depend on the subculture of the society. History of biomedical ethics. Before World War II, there was no generally accepted code governing the ethical conduct of human research. In 1947, Nuremberg Code, which is a set of ethical principles to human research, was developed focusing on the consent of participants, qualified staff, and conditions. This code represents the beginning of what we now know as modern medical ethics. Declaration of Geneva to the revision of Hippocratic Oath. In 1964, Declaration of Helsinki. The World Medical Association tied the principles of Nuremberg Code and Declaration of Geneva in one document called Declaration of Helsinki. It has undergone numerous revisions since its first draft, last updated 2013, which is considered the foundation of human research ethics worldwide. In 1974, Tuskegee study. Tuskegee study of untreated syphilis in the Negro male resulted in the passage of National Research Act of 1974 and the formation of National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. In 1978, Belmont Report identified 3 core principles: respect of persons, beneficence, and justice. These principles can be applied to both medical research and medical practice. Laboratory medicine, like other areas of medicine, is obliged to adhere to high ethical standards. Decisions about diagnosis, management, and research depend on interpretation of laboratory results. The involvement of medical laboratories in biomedical research will usually focus on analysis of tissues or fluids. There are ethical issues that are unique to laboratory medicine and other areas in which ethical issues uniquely impact the laboratory practice. Biospecimen research encompasses the practices of collecting, storing, and using biological specimens, example tissue, blood, urine, and body fluids, and the clinical data for research purposes. Biospecimen research is essential in COVID-19 era because these studies can help provide novel insights into viral infectivity, generation of a new medicine or vaccine. Although biospecimen research may contribute to discoveries which ultimately can lead to life-saving results, pandemic biospecimen research is associated with some important and unique ethical issues. There are several ethical issues in laboratory. These issues have divided into 3 phases: pre-analytical and analytical and post-analytical, according to the laboratory work distribution. Pre-analytical, which include informed consent, all tests benefit to the patient, access to all tests at a reasonable cost. Analytical phase, right to decline a specimen examined, best possible analytical result to patients, no discrimination according to age or gender or race. Post-analytical phase, reporting and interpretation of results and residual specimen, which is called leftover specimen, and data access. 3 basic ethical principles in medical laboratories: justice, respect, and beneficence. Pre-analytical phase means patient identification, collection of samples, handling of the samples, sorting out, pipetting, and even centrifugation. Respect. Consent must be understood by the patient. The patient's right to refuse to get tests done should be appreciated. Any information regarding patient demographics, their visit to the laboratory, the tests and the requirement for these tests should be provided only to suitable personnel. Confidentiality should be maintained. Beneficence. All tests performed referred must benefit to the patient. Any adverse event during or after sample collection have to be managed by the trained workers according to standard operating procedures. Collection of samples should be in a safe method. The additional samples shouldn't be drawn without informing and getting the permission from IRB. The specimen should be well labeled with minimum 2 unique identifiers. Transportation should be done to protect the integrity of the sample. Justice. Provide access to several laboratory tests at a reasonable cost. The laboratory should evaluate the need to introduce new tests and the opportunities to discontinue older tests when better tests are available. No preference should be given to some patients in order to facilitate or accelerate the collection procedure at the cost of others. Analytical phase begins when the patient specimen is prepared for testing and ends when the test result is interpreted and verified. Respect for persons. After collection and the processing of samples, patients have the right to refuse to have their specimens examined. Special care must be taken to preserve confidentiality in point-of-care testing as much as possible. Beneficence. The aim of the laboratory is to make available the best possible results to patient. Quality assurance program, including quality control analysis, proficiency testing, and accreditation of lab are required. Only qualified, skilled, and regularly accredited staff should be authorized to execute point-of-care testing. Justice. No discrimination in the examination of patient samples based on gender, age, and race. Laboratories should also state which tests are included and their expected turnaround time. All specimens are being analyzed correctly and a timely routine. Post-analytical phase, which is the final phase, evaluation of lab test results. Respect. Patients reasonably expect that their specimen will not be used beyond the test prescribed by the clinician, and they used for only prescribed test for medical purposes. The patient and the referring clinician are the only authentic recipients of laboratory data. Reliable communication methods are to be used to deliver lab reports. Beneficence. Results misinterpretation may harm the patients, may be reduced when a skilled staff would interpret the reports. The reporting should be in a proper time. Complete report covers the name of the test executed, a reference interval, units of, and a remarking that the result is abnormal if the test is abnormal. Turnaround time should be minimum for any test without affecting quality of the test. Justice. Reporting of the test results must be consistent for all patients. Speedy reporting may possibly be demanded for some results, including critical and significant risk results. Remaining patient samples, leftover samples, shouldn't be used further without patient's knowledge. Conclusion. It is necessary to incorporate the core principles and the guidelines of bioethics in areas of laboratory medicine. Ethical concern about respect, beneficence, and justice are evident in COVID-19 biospecimen research. Any laboratory involving human participants should follow the national and the international standard and the practice of ethics recommendations. It is required to develop an ethics policy and add it to the laboratory's quality assurance manual. Development and implementation of an ethics training program for laboratory staff to promote the development of the professional life, highlighting human values, responsibility, and honesty. Thank you.